Hi guys, welcome back to 4 Strong and Growing. I didn't necessarily think that I was gonna make it to 39 weeks to make this video, but here I am. I'm starting to think that I'm going to eat my words a little bit because in pretty much every single one of these weekly updates, I've been saying baby's due on Thanksgiving, but I have a feeling she's gonna come early. And it just keeps on going and going and going. I keep on waking up and I'm still pregnant. Let's just get into it. Today, I am 39 weeks pregnant. So I wanna go over all of my symptoms from week 38. In case you don't know, my name is Alexa. I'm pregnant with my third baby right now. She's due on Thanksgiving, and I'm not gonna say that I think that she's gonna come soon, because at this point, it's induction at 41 weeks. Oh, jeez. Why did I jinx it? Although, according to ACOG, I am now officially full term, so technically I shouldn't have necessarily been hoping that she would come any earlier than this, because according to whatever research they have done, babies have better outcomes when they're born at 39 weeks or later. Not too late, but between 39 weeks and 41 weeks, I think, or 42 weeks. So yeah. Let's just get into all my symptoms from week 38. Everything's on my phone. So I have on my birthday, which was November 7th, that's when I thought that she was going to be born. That was my official guess. Like, I think we're going to share a birthday. We did not end up sharing a birthday. But on my birthday, I had a lot of lower back pain. So the theme of week 38 is me thinking that I'm going into labor because I have all of these signs of early labor. If you Google, what are the signs of early labor? It's like all of these things, except my water didn't break and I don't have contractions. But basically every other symptom is my week 38. So this whole week, I thought that I was really going into labor, and I just kept on thinking, maybe tomorrow, maybe tomorrow, maybe tomorrow. I had lower back pain, especially in the evening, but it went away by the morning. I've never actually experienced back labor. I've heard that it is absolutely horrible. Instead of feeling your contraction in your uterus, you feel it in your lower back. And apparently it is excruciating. So I was thinking to myself, I hope this isn't like the beginning of back labor and I'm just gonna have back labor through the whole delivery. But I took a hot shower, not hot. I took a warm shower and then it was gone by morning. The next day I had loose stool, and I had loose stool for like a couple days prior to that as well. And I was peeing a lot more often. And then that night I looked in the mirror and I noticed that my belly had dropped. As far as the loose stool goes, loose stool is another early sign of labor. Apparently, it's your body's way of naturally clearing out your system and making room for the baby to come out. Before your belly drops, it's sitting pretty high up and you don't have a lot of space between like the bottom of your boobs and your tummy. But once your belly drops, you get a lot more room here. You can breathe better. I feel like my appetite has increased because my stomach has more room to expand. But where I really saw it was when I did a side-by-side comparison of pictures of my belly that I've taken. I don't know exactly when that happened, but November 8th is when I noticed it. So that was 38 weeks and 2 days. 38 weeks and 4 days, I wrote cramps coming and going, especially at night. And that's kind of continued to happen. So I get these little cramps that kind of feel like menstrual cramps, and then they just go away. I haven't really been having Braxton Hicks contractions that I've noticed, just a little bit of cramping. I'm also peeing in the middle of the night every single night. That goes along with baby dropping. Now that I can breathe better and I have more room to eat food, the trade-off is that she's on my bladder even more, so I am peeing constantly. One thing that I didn't expect, but is actually also an early sign of labor, is that I'm getting better sleep. It's especially weird because I am getting up to pee in the middle of the night every single night, so I guess in that regard it's not much better sleep. I'm not having any insomnia. I'm not having trouble like getting back to sleep afterwards at all, and when I am asleep it feels like quality sleep. And then I just had my 39-week appointment. I just got home from it, but I'll include it in this video. So they did all the things that they usually do. They took my weight. I'm 134.8 pounds. They did my blood pressure, and then they did the urine strip test again for the glucose and the protein in my urine. And I still think I'm tripping that off. They don't say anything anymore. The last 2 times that I went, they haven't told me that I had protein in my urine again, but I'm pretty sure I did both times because I think it's just looking for a color change. The yellow square always turns a little bit green. So I think I'm setting that off with protein in my urine. The first time I did it, and she was like, oh, there's protein in your urine. And then I asked the doctor, and he said that it was normal at the end of pregnancy to have that. It was just like my kidneys working overtime. I'm not really concerned about it, and no one is bringing it up anymore anyway. They measured my fundal height, which is when they take the tape measure and they go from here to here and measure that. I never knew that that number corresponds with the number of weeks that you are. So I measured 39 today. So that's good. They listened to her heart rate. That was 150 beats per minute, which is perfectly normal. And then I consented to the cervical exam again, just to see. I had a feeling that I haven't really dilated anymore, and it's true, I'm still like 3.5 centimeters dilated. I feel like once it starts to go any more, it's just gonna put me into full-on labor. So I'm not expecting to dilate anymore until it's actually time. And then the last thing is that I denied a membrane sweep. If you don't know what a membrane sweep is, it's when your doctor will insert a gloved finger, maybe 2 fingers, and kind of separate your amniotic sac from your uterus in like a circular motion like this. And it's supposed to kickstart your labor and put you into labor within 48 hours of doing the membrane sweep. Sometimes it's also called stripping the membranes. I said that maybe I would do it next week at 40 weeks. I'm still not exactly sure. To be honest, I haven't done a lot of research on membrane sweeps, so I'd like to look it up a little bit more. But at 39 weeks, I don't think I'm really going to be doing any sort of intervention to kickstart labor. Even things like eating dates or like whatever they tell you to do on the internet, I'm not really interested in doing any of those things. Just because I worry sometimes that they can be harmful. And some people do suggest pretty controversial things like castor oil. Don't do that. So I just avoid all of it. There are risks and benefits to a membrane sweep, just like any medical procedure. As far as I know, you have to be at least a little bit dilated to do a membrane sweep. The doctor has to be able to get their fingers in through the cervix. There is a risk that you can rupture the membranes, meaning your water breaks during the procedure, which isn't necessarily a bad thing, but that's why they usually will do it after 39 weeks when you're full term. It can also cause cramping, and then that can be confused for contractions. It can cause bleeding, and there might be some other side effects as well. But it could be a good idea to do a membrane sweep if you are at your due date or past your due date, you're getting closer to needing an induction. For me personally, I would probably try a membrane sweep before I just start doing Pitocin. But again, I still need to look into it a little bit more before I make a decision, and we'll see if I make it to 40 weeks. Another reason why I denied it today is that my mom is flying here tomorrow. I just don't want to do anything to induce labor before she gets here. It would just be better if my mom was here to watch the kids and stay with them at home here while me and Matt go to the hospital. That is the plan for now. Possible membrane sweep next week. So that was my 39-week appointment, and those were all my symptoms from week 38 of pregnancy. I think at this point, I need to stop trying to overanalyze every single thing that's happening in my body, and I just need to be a little bit more patient. So this week is going to be a peaceful week, a patient week. Okay guys, so that is the end of this week's video. We'll see if I see you at 40 weeks. I'm not sure if I will. It's not up to me. But either way, I will see you in the next one. Bye.